My name is Missy Newland. I originate from Grayson, Kentucky. I now live in Louisville, Kentucky. I clean houses to make ends meet. This gives me flexibility to assist my mom as needed, post-pancreatic cancer and her recent stroke. Thanks to Medicaid, I was given answers after a lifetime of chronic pain and tachycardia. I have POTS, hypermobile Ehlers-Danlos syndrome, and Chiari malformation. This means high-pressure headaches, balance loss, and brain fog. These aren't just diagnoses on paper, but daily hurdles I must jump to keep working. Without Medicaid, I wouldn't have access to specialists or the frequent imaging I need to prevent further damage. Medicaid is the only way I can stay healthy enough to keep working. We are already facing skyrocketing electric bills and inflated food prices. So for someone with my list of specialists, $20 copays can add up fast. Cost-shifting copays beyond a federal minimum for low-income Kentuckians would not encourage personal responsibility. It will force us to choose between the needs of our family over our own health. For a gig or retail worker, hours change weekly. Added paperwork requires asking clients to sign income papers 4 times a year. This is not only an administrative burden, it's also an invasion of privacy because I'll be disclosing what kind of health insurance I have to my clients. I know a lot of HB2 is the state trying to comply with HR1. But knowing how many me's are here in the state of Kentucky, we should take a conservative approach instead of rushing into overt compliance. This is certainly not the time to reduce Medicaid state funding. The system is already overwhelmed. We can add on lost hours waiting on the phone for help from an understaffed cabinet, and we have chaos ensue. People won't lose coverage because they're ineligible. They will lose it over procedural formalities, difficult timelines, and missed signatures. We are putting the buggy before the horse by rushing into rigid requirements before federal regulations are even finalized. Copays are higher, reporting requirements in HB2 are more than HR1 requires, and the state's budget proposal in its current form leaves a scary hole in necessary funding. This isn't efficiency, it's a self-induced barrier. I ask my lawmakers to slow down. There are human lives attached to these bills, not just dollars and fiscal years. We exist, we matter, we contribute, and we deserve a system that supports our health rather than not giving us a chance. Let's keep Kentucky covered and healthy. Thank you.